I wanted to showcase one of the businesses that's cutting edge in the field of providing healthcare, and that is the Health Hub. With me is Earl B. Maes, who is the owner, but also the physician of this new and dynamic way of providing healthcare in Southwest Missouri in the Springfield area. And so where did this vision come from?
Yeah, I wanted to make sure that healthcare was affordable to everybody. And I've had a pretty long career in medicine. I was an ER physician for a couple years, then I became a radiologist. So I like to call myself clinical radiologist because I've experienced both sides of it. And so by being on both sides, I understand the frustrations that a lot of these clinicians face. And I can also see where a lot of the cost and extra expense is going with healthcare. You don't have to go to the urgent care for everything or to the ER for everything. Your primary care should be done with a direct primary care model. You know, if you go to the hospital and you get an MRI over there, it's going to cost you $4,000. But we can do the same MRI with the same equipment that the hospital has for $600.
That's crazy. So why do you think there's such a discrepancy in the prices?
Number one is the insurance companies, so they can take a 20% profit margin right off the top. Right. The second thing is administrative costs. About 35% of your dollars are going directly to administration over the plan. So that's because we've made it so complicated. There's the whole billing process that's just added this huge layer of complexity that doesn't need to be there.
You're telling me that the administrative costs are that much. By getting rid of those costs, you can not only see fewer patients, but be cheaper than the traditional system.
Right now, our current system spends so much money on the administrative costs. Like I said, 35% of what we're paying in our premiums is going to administrative costs. So we can streamline that down to almost nothing.
I think that because this is such a paradigm shift for a lot of people, it almost seems too good to be true.
Absolutely. Yeah, I think honestly, that is our biggest barrier that we're dealing with right now is like, people, you don't have to pay this much for health coverage. Creating those new norms is the challenge.
Well, I can't wait to see what else, the rest of the clinic and meet some of the staff.
Excellent. Let me show you around here. Okay. So right here, we have one of our clinic rooms. We're able to do basically a normal clinic visit and then also any minor procedures. So we can do stitches, we can do splinting. We do everything up to ER level. I mean, who wants to go sit in the ER for 8 hours to get stitches? That can all be done in an outpatient setting. It does not need to be done in the hospital setting, in the ER, or even in an urgent care traditionally. So we can do most of the labs that patients are going to need, but any routine labs that you need, we can do here with these 4 or 5 different lab machines that we have.
It's fantastic.
So this is the MRI machine on this side. It's a 1.5 Tesla magnet, and it's hospital quality. We're very proud of it. We're going to keep it busy. There's so many screening exams that we can do with that really make a difference in people's lives. And then this is a CT scanner here. It's a 128 slice CT scanner. There's so many slices, it really lowers the radiation dose. So it's detecting all those different spaces at the same time. And so it lowers the radiation that the patient gets. So it's really helpful.
That's a good thing.
Yep. This is our DEXA scanner. So we have a dual camera DEXA scanner here that is able to measure at the same time your bone density, but also your muscle mass and your fat percentage. So we can check you for the osteopenia, which puts you at risk of fracture. But especially in men, we carry our weight either on our shoulders and back or in our belly. And it's the fat that's in the belly that causes a high risk for heart disease. And so this will actually quantify the exact amount of visceral abdominal fat you have so we can tell you your risk. And here's our ultrasound room. So in here, we're able to do, a lot of the screening exams. So we have a lot of great tools here. So we don't have to force everyone down the CT path or the MRI path. We can have them get whatever imaging they actually need for the disease that they have.
Okay.
So we normally shoot our podcasts here. So we have the Maes Medical Minute podcast. And then we also have a site where it's askdrmaes.com so patients can ask questions specifically about health-related issues.
I wanted to just get your blunt and honest opinion about healthcare reform that really gives that decision matrix back to the patient so that they're purchasing the insurance or whatever healthcare that they want to purchase.
Yeah, I think the direct primary care model fits in perfectly with MAHA because MAHA is saying, you know what you need. So by having the control over their health insurance, they can pick in their health coverage, they can pick what works best for them. And it does not have to be the one-size-fits-all health insurance that we have currently. By doing that, the cost comes down significantly. And then with MAHA, it's helping them fund the plan that they need, not the plan that everyone else wants them to get, so that we can try and get the health insurance premiums down.
You know, Bobby Kennedy's team and I have been working within this MAHA plan, trying to figure out how do we help people not just get access to the health care and the health insurance that they need, but actually to be healthy.
Right.
And so within the MAHA plan that we're drafting, we're letting people take some of those dollars and get a gym membership. If they want to go to the grocery store and buy vegetables, fruits,
Right.
chicken, a steak, encourage people to buy that as opposed to buying all of the things that are unhealthy. And look, if you want to buy the unhealthy things, that's great, but we want to give you a tax incentive to buy what's healthy, to try to get ahead of a lot of this on the front end. The focus is not just about being insured, but being healthy.
Right. Yeah, no, you're so right there. We know that in Missouri alone, 2 out of 3 people are obese. There's so much prevention that can be done. There's so much screening that can be done up front. Then once we understand the full complexity of what's going on, we can treat them appropriately.
You know, spending this time with you gives me at least a modicum of hope that the healthcare system might get better.
I hope so too.
Dr. Maes, it's been a pleasure. Thank you for introducing us to something that a healthcare system that actually might be affordable and better and make people healthier than the solution that we have today. And so thank you very much for your time.
Thank you, and I appreciate your time and taking the work that you need to do with plans like MAHA so that we can take care of the patients in a better way.